Hello, I am Dr. Rajesh, hepatologist from Sri Gokulam Hospital. July 28th is a special day. Every year, July 28th is observed as World Hepatitis Day. Why there is a separate day for hepatitis? What is hepatitis? Hepatitis is a liver inflammation, commonly caused by 5 types of viruses A, B, C, D and E. Among this, B and C are very important, notorious to produce chronic hepatitis, which leads to cirrhosis and even hepatocellular carcinoma later if it is undiagnosed in the early period. What are the complications of this hepatitis B and C is? Commonly it is a cirrhosis first. What is cirrhosis? It is a liver shrinkage which leads to loss of liver function, which may produce ascites, that is abdominal distension, blood vomiting, jaundice, encephalopathy, that is altered sensorium, even kidney failure, and last but not least, it is a hepatocellular carcinoma, that is a liver cancer. So, these are the complications of hepatitis B and C. Worldwide, more than 300 million people are infected with hepatitis B and C. Among this, 1.3 million people are dying every year due to hepatitis B and C complications. Why this is important is early diagnosis. Most of the people infected with hepatitis B and C, they don't know whether they are infected or not. So, we have to do testing, blood test, simple blood test, which can diagnose hepatitis B and C. After the test is positive, then we have to do some more blood investigations to know how much the virus is infected in the body. And whether the liver is damaged or not, we can diagnose by ultrasound abdomen. And the fibrosis is exactly measured by using a fibroscan. We have a special scan, just like an ultrasound. We can do a fibroscan. By doing this, how much the liver is fibrosed, whether it is going for cirrhosis or not, we can diagnose early by fibroscan. And rarely we do CT scan also for any complications. With this with this diagnostic modalities, we can conclude which patient is requiring treatment and patient is in which stage of the disease. Accordingly, we give drugs. We have very wonderful drugs, only oral drugs for hepatitis and B and C. We can completely eliminate hepatitis C with the oral drugs, and we can control hepatitis B with again drugs. They are all good drugs without any side effects. So, how to prevent the transmission of hepatitis B and C? Hepatitis B and C are blood-borne infections. So, you should not share needles, share razors or toothbrushes. Safe hygienic practices is important for prevention of hepatitis A and E. So, use a safe and hygienic water and food practices. Then we have a wonderful vaccine for hepatitis B. By giving vaccine, we can prevent transmission of B from one person to other, especially if the spouse is positive, the other one have to take hepatitis B vaccine. And if the mother is positive, by giving vaccine to the baby within 12 to 24 hours of birth, you can completely prevent mother to child transmission. So, by practicing safe, healthy practices, taking vaccinations, early diagnosis by blood test, and if it is positive, with the treatment with the oral drugs, we can eliminate hepatitis B and C from this world. Thank you.